today many of the problems would be solved, right? So that's why I think I just a minute. Huh? I'll be back in a minute. Just a minute.
Good morning, sir.
Yes, yes. Good morning. Good morning. Okay. So today we'll be starting with our first lecture. This is some things which I explained to you before. We'll be starting with this first lecture, language of anatomy. This is present even on YouTube, right? So I have given you this tiny URL. So on this, when you'll go, you'll be able to get that lecture. Now, what would it really happen is in case if someone is missing today's session, they don't have to worry. They can just go to this URL and they'll get this. Yes, it would be exactly the same. But yes, it would happen every time that whenever we'll be discussing something live, some new things will keep on coming up, right? But at least if in case I'm getting few of the emails, oh, thank you, Maiman. Happy Guru Purnima. So nice of you. Okay. So the thing is, in case if someone has missed this session, still कोई problem नहीं है, वहां से जाके just revise कर लीजिए. Few of the lectures, right, for just 1 or 2 months, all the lectures, they will be of utmost importance because they will be the foundation. Okay? So this is the tiny URL, and in any case, it will be landing onto our this. So I'll just explain everything right? You know this part, Tuesday, Thursday, Saturday, 10 a.m., right? That's the Zoom meeting ID, passcode, you know. This is the YouTube link. So in case you can even scan it and straight away you'll be landing on that lecture, right? That is the language of anatomy. This is the tiny URL that is also, it has been given. Then can anyone just test this link? Because this is what I have said is this is link of assets. Assets means all the things which will be shared between you and me, right? So that is I have named it as assets. So hope everyone must have received, must be able to access all those 4 books and everything. Any problem?
Yes, sir.
Yes.
Thank you, Atharva. Acha. So just check it out, right? Whether this link is working, and second, whether this QR code is working.
So the link
Yes,
is
sir.
working. I checked it.
So it's working now?
Yes,
The
sir.
link is working. Yes, sir.
Okay. Okay. I'm not getting the journal meeting shows everything. Uday, are you there? Because I've received. Just a minute. It is not possible because everyone has been joined. Anyone? I don't think because you're already logged in, so you must not have faced the problem because it is inappropriate to ask you the question, was there any problem in joining the link?
Sir, please summarize the last class.
What did you ask? Hello.
Summarize the last class.
Last class, just go through that PDF, right? So it will keep on say coming into the revision. So don't worry about the last class. Was there any query? Is there any query? I have received so many emails that you have successfully raised your level from 225 words per minute to 300 words per minute. Some of you have crossed even that limit. So that is very nice of you and it's excellent. If there is any trouble, if there is any problem, right, do let me know. Acha. Last time we talked about, within 5 minutes, I'll just let you know what we did last time, right? So it was a discussion on super reading. Super reading is how to increase your reading speed. So it was about how to increase your speed plus comprehension. Comprehension means how much you can really retain or remember so that you can express it in your own words, right? There were 2 components. Then this was the first part where we talked about Spreader. So Spreader is nothing but it is like an app. It is one of the website. You go over there, you just paste the content, and then you play, and rapidly it will start displaying the words at the pace what you have defined. So if you have defined it, say 300 WPM words per minute, so it will be firing the words at this rate. That means every second there'll be 5 words, right? In case if you feel like you can know this is just too much, decrease it. You can increase or decrease in the increments of 25, right? So that is the thing. And the practice was given. Regarding the comprehension, the keyword was, these were the keywords. So that means whenever you study, you just focus on these 3 types of studies, which is called as the skim, scan, and study. Study type of reading, it comes at a later stage. So right now we won't be touching it. We'll be coming to study type of reading about 2 months from now, right? When you have practiced these 2 skills properly, then we'll come for the study. Study type of reading is, yes, Rashid, just hold on, right? I'll show all the links and everything again. So the study type of reading is, that is when you have learned one topic and then you want to go into the depth of that topic from a reference book. Say, for example, it is like you have learned the brachial plexus, right? Brachial plexus. This brachial plexus you have learned. You know reasonably good things about it. And then you want to go into the depth by going into the Gray's anatomy. So now in Gray's anatomy, it would be spread across so many pages. So how to go that fast that you know, ye pata hai, this you know, no. So that is the study type of reading. When you know a subject and you enter into a reference book and you pick up something which is new and you add, right? Mind map is like what we are doing right now. It is a mind map, right? So you write keywords divided into 3 parts. Here, there are no running long sentences. In fact, this is the secret how you can study huge topics effectively. We know about Harvard University. We know about Oxford University, right? In all these universities, you'll find that for the first 15 days, they don't teach you any of the subject. In fact, they focus only on super reading because that is the language in which they speak for rest of the journey, right? So there were, say, 2, 3 emails and see, it is very nice, right? To admit, you said, no, I'm not finding it comfortable. Absolutely right. Absolutely right. And in fact, I appreciate that you said, I'm finding it difficult. Those mere difficult hai, tabhi to no one is following it. People have got the wrong habit of going line by line, word by word. इसी pattern पे right from the beginning. क्योंकि क्या in class में they used to say कि लो book, start reading. And then we were having that habit of reading line by line, word by word. But there is a difference between written English, right? What it is called as that there is a difference between written English, spoken English, and English to be read. Written English, you can't make any of the change. You if you have to communicate anything, you have to write a novel, so then you have to write every word, every bit of it. Correct? When someone tells you, okay, read it, so then you have to go line by line, word by word. But when I say English to be read means when you are learning it in your brain, so then the pattern is completely different. But this is the pattern for that. Because you have to study extensively, right? So that's why you have to beat everyone. So time to time, I'll keep on telling you various skill sets. You just follow it and see the difference. Right? Many of you, I really appreciate when you said that you started with 255 and just within 2 days, right? You said that you reached the level of 275. Fantastic. Keep doing it. Keep doing it and see what happens. Because now there were so many emails, I'm unable to remember everyone's name, right? But one thing, what you said is, yes, I can go through those words faster. I can pick up the words, but I'm unable to remember it. Hoga, it is totally normal. Totally normal. Gradually, your brain will also start syncing with it at such a pace. So there won't be any problem. Keep doing it, right? And as we said that you need to do it for at least 4 weeks, है ना? 4 weeks. So अभी तो it is like just 2 दिन हुए हैं. Yeah. So don't give up. Don't get disheartened. कुछ भी लगे कि नहीं बहुत तकलीफ है, send a mail. Right? I've tried to answer as many mails as possible. Okay. Regarding the initial, Acha, Sudhanshu, what is the ideal speed of super reading? Ideal speed of super reading is fight with yourself. Never ever compare yourself with anyone. Even जब अपने टेस्ट लेंगे ना, that weekly test or monthly test, whenever we'll be taking the test, I'll never ever compare के अरे अनाया, हाँ अब मैंने सही नाम बोला, right? So what is the score of Anaya and what is the score of say Matilda, and then compare both of them? Never ever. Someone is on unmute. Kindly mute. Sanket, just mute kar lo. Thank you. So the thing is, if your score is, let's say, I'm just writing, say it was 50 questions out of 50 questions. If your score was 35, next time, even if you go to say 39, shabash, very good. You are just fighting with yourself. It is exactly like gym. Gym में जाते हैं तो with whom are you fighting? No one. You are fighting with someone who is in the mirror. That means you only. Right? तकलीफ क्या है? Trouble is when we start comparing with the others. But that's where the stomach pain starts. He or she is at this level and I am at this level. No, never do that.
How to give this?
Yes. So, okay, this is the thing. No comparison. Just keep working. So there is no ideal speed. Ideal speed is when you improve, and there is no limit because people are even going at the rate of 700 words per minute. Right? Even they go at this speed, and it is possible. The capacity of the brain is enormous. Two more things. You wanted to have this link, right? This is the link. So this is the YouTube link. Right? This is the YouTube link. You'll scan and straight away you'll reach to this particular lecture, this lecture only. And this is the tiny URL again of this lecture. This PDF will be placed at the point of where we say that link of assets. So today a new folder would be created, general anatomy, and this PDF will land over there. Okay. So that's clear. And this was our last time's revision. And we start with our today's topic.
Sure. Hello, sir.
Yes.
Thanks for the
One by one.
Yes, sir. Can I say now? Sir, I have not received any link of the PDF that you have sent in me.
No, the link was not sent to anyone. This is the link. Acha, just try this link. Try this link right now. I don't want.
Okay, sir.
Just try it right now. Are you landing it to the place where there would be one folder of books and good books and another folder is of super reading? Parent folder is medical 2025. Are you reaching over there? So you can either go by this method or you can just scan this QR code.
Okay, yes, sir. Yes, sir.
Getting? Shabash. Sure.
Yes.
Okay. So let's start with our today's topic, right? And this is the language of anatomy. Language of anatomy means why this is necessary? Because every language, every specialty, it has got its own language. Because when we write, right, when we write a report, so people, you must have say heard that ये डॉक्टर जो लिखते हैं वो डॉक्टर ही पढ़ सकते हैं. Even the CT scan report, right, when it is written that there is a SOL seen near the hypothalamus, right? People would say कि ये क्या हो गया? SOL is space occupying lesion, but it will always be written as space occupying lesion, situated this much lateral, this much medial to this place, this place. It is like a reference. By the end of today's session, it is like when we'll be communicating, you'll be able to, even if you close your eyes and we read the report, right? The picture should be generated into your mind with clarity that what exactly are we talking about? Because when we'll be starting with the anatomy and when we'll place the incision, so we'll be coming across all the words whatsoever we are discussing today, right? So here it is, the anatomy. The word anatomy itself is, right? It is made up of, So anatomy is, ana means to see, and Tommy means not the kutta, but to cut, right? This is the Greek word. Right? So to cut and see, right? So that is the anatomy. It came from the word anatome. So anatome is whenever you cut anything and then you see it. But that is anatomy. So it means when you'll be learning anatomy, you'll be watching. You'll be watching everything. Right? Every structure. You are not much concerned about how it functions. No, that comes into physiology, right? So physiology is normal functioning. The structures which you are seeing in anatomy, physiology will be how do they function, right? So that is first anatomy. This is what is called as the cadaveric. Cadaveric means dead body, which is placed in front of you. And you will be understanding it in two ways. One is the regional, second is the systemic. Right? Regional and systemic. Regional is right from the day one we are talking about is we'll start with upper limb, then we'll go for lower limb, then we'll go for thorax, then for abdomen, then for head and neck, and then for brain. This is the order which will be following rigidly. This is not the order which every university might be following, right? So Yes, at times, in case if they start straight away with thorax, so then you have to really adjust. But this is the reason कि अभी आप यूनिवर्सिटी जाओ पहुंचो. If you reach to that specific country, before that we finish as much as possible. Even if we finish these two, upper limb and lower limb, you'll feel so comfortable into the anatomy because now you got the reference. You know, okay, this is how the muscles are to be learnt. Right? अच्छा, कुछ some of the suggestions were like, why don't we use PPT? Well, everything is written like this is called as chalk and board, right? And that's the habit. हाँ, कई बार इसके अंदर कोई स्पेलिंग ना समझ आए तो मुझे बता देना. अभी के अभी I'll rewrite it. ठीक है, I'll rewrite it. But this is upper limb, lower limb, legs, thorax, abdomen, head and neck, and the brain inside. Right? This is the order which will follow. Systemic is, yes, we'll be doing some systemic anatomy also, system wise. Right? So when we say system wise, so we say osteology. Osteology means the bones. Logy, whenever that word would come, Logy, logy. Logy means science. So osteo means bones, science of bones. Myology, science of muscles. Angiology, right? Science of blood vessel. When we say graphy means uska picture rakhna. So that's why when we say angiography means what? We display the picture of those blood vessels. So we inject the dye, right? As that dye goes into the circulation, we take the image because normally when you take the X-ray, right? When you normally take the X-ray, so those blood vessels, they are very thin, delicate. So X-rays will be passing through and through. When the X-rays they are passing through and through, you won't be able to see it, right? Will very soon. I think by next week we'll have one lecture, one extra session on radiology, clarifying all the concepts of radiology. Because right from the beginning, now you'll be able to understand कि किस चीज का एक्सरे ले सकते हैं, किस चीज का एक्सरे नहीं ले सकते. And the moment you take admission in medical science, you are doctors for rest of the public. Seriously, right? So they might come up कि अरे डॉक्टर साहब जरा एक्सरे देख दो ना. You say कि यार I'm in first year. हाँ डॉक्टर तो हो ना. They'll consider like that only. So you should be able to decipher. किसी को सलाह देनी हो तो you should be able to say कि इसके अंदर you go for X-ray, इसके अंदर you go for CT scan, इसके अंदर you go for MRI, इसके अंदर you go for PAT scan. Now those things they are like absolute wonders for others, right? People consider सब same ही है. No, they are absolutely different. And I'll show you all those images, right? I got a collection of more than 40,000 X-rays, more than 4,000 CT scans, more than 3,000 MRIs, ultrasounds, whatever. So just let me know. Just let me know what do you want, right? All those emails. Now I won't be. Yeah. Okay. See. But इसके बाद I won't show this link again. अभी के लिए टेंशन मत करो, ठीक है, फिर भी रख लो. Because it breaks the link, yaar. So whatever the questions are there now, just keep them in reserve. So what I was telling was, so that entire collection, you say that yes, I want to see more number of X-ray chest. I'll show you 100 X-ray chests. As such, so I'll be showing you that many. But if you want to see more, let's say you want to see कि किसी को stab किया है, तो how will it? What are the different types of stabbing? So some of the stabs, when the knife is deep in and straight away it is just near the heart. एक आधा इंच भी अंदर गया होता तो मर गया होता. So all such X-rays, and they are all are real X-rays, right? Real patients X-rays. So there is all very interesting story behind every X-ray, every case. So we'll be discussing exactly like that. Say for example, if we are learning brachial plexus, right? Brachial plexus, which is one of the important component of upper limb. So what if किसी ने यहाँ छुरा मारा, उसका हाथ ऐसे लटक गया. तो just by look, what do you guess? What must have happened? Baby is born, and then you find that one of the hand is not working because that baby was born, but during delivery some mistake was committed. So what could it be? What can it? कोई बच्चा कूदा, right? वो पार्क में, और ऐसे लटका, एंड देन लटका, और उसके बाद जब वापस आए तो उसका हाथ नहीं चलता, right? So all these are very interesting cases. One of the very interesting, say, that is when person is with girlfriend, right? And now if she is sleeping over here, right? If her head is over here, so that is what is called as the Saturday night palsy. Now, because of the compression of the head, right? That nerve gets compressed, and in the morning when person finds that his hand is not working. So yes, there are some very interesting things, right? Nothing to worry because that nerve recovers very fast. But yes, it takes some time. So all those things, yes, Uday, it is like that, right? बड़ी इंटरेस्टिंग चीजें हैं, so many interesting things out there. ठीक, so coming back to this, so that is the systemic, right? We'll be learning all these things parallelly. ठीक है, so angio, then arthro, right? This is arthro, ARTHRO, arthrology. Arthrology, where we'll be studying only the bones, only the joints, right? Osteology is bones, arthrology is joints. So we'll be discussing the joints. Now, some of the joints, they are like a chamber, right? The way in our car there is a gearbox, right? So there is a small gear which is connected to bigger gear, and as you shift from, say, neutral to first, the size of the gear is big so that it can really pick up the whole car and it starts moving. As the car starts moving, the gear size, it becomes smaller and smaller and smaller. The top gear is very small. Its function is to rotate. It will be giving less of the torque, but it will give more of the motion. Our body is defined amazingly in this manner. But all these gearboxes, there is all these gear systems, right? They are filled with fluid. That is the gearbox oil. Because when they move, so you want to avoid the friction. Here to this joint, right, the joint, knee joint, which will be bearing the pressure of the entire body for whole life, that is filled with fluid, which is called as synovial fluid, right? All these things will be discussed at length. But if that fluid gets decreased, so then bones घिसना शुरू हुए. And then that is what is called as the bone erosion. God said कि मुझे पता था ऐसा करने वाले, तो उसने बीच में एक layer भी दी, cartilage, right? So that these two bones, they don't, say, rub against each other. But nahi, we abused our body, so cartilage gayi. And then when the bones, they start eroding with each other, bones, they have got good nerve supply, then starts the pain, right? So all these things, they are very much associated with the pathology also. Neurology, my favorite, right? Neurology, to matlab you'll go crazy. Okay, God is what? Computer scientist, God is wonderful electrician, and whatnot. And when you see the development of the brain, how it really spreads, how all those nerves, they spread, and it functions so amazingly. So this is what is called as the systemic anatomy, right? You are going system wise. Now, our purpose will be, yes, ask a question straight away.
So we have to write this.
No, don't write anything. Just understand, right? Because every topic whatsoever I have written, right, will be discussing at length as it will proceed. But यहाँ पे the keywords are mentioned. So for example, when I say angio, so that means it is blood vessels. बस इतना याद रखो, बहुत है. हाँ हंसिका.
So, if we start with the regional thing, and in the regional, say we started with upper limb. So, in upper limb, we'll study all the systemic points.
Very right. You are 100% right. Say we'll be starting with upper limb, and how we'll study. See, कुछ भी कभी भी सीखना हो तो first we need to know the framework, na? Framework, right? If we want to make a building, so how the building is created? First, they will just create those pillars, right? A framework, that is
Yes.
bone. On that bones, we'll be applying the muscles, right? And that's how, and then how the building is created means the framework, then they'll be laying the bricks के बाद उसके अंदर electric wiring, so that is our nerves, right? पानी की pipeline डालना शुरू किया, so that is our angio, right? Blood vessels. And finally when everything is complete, तो फिर finally plaster लगा के सब कुछ खूबसूरत बना दिया. That is the skin, soft tissues and the skin, and subcutaneous fat. So सब subcutaneous. Cutaneous means skin. Just under the skin, there is fat. So that is subcutaneous fat. So that gives the entire beauty. So when they say that beauty is just skin deep, actually the meaning is like that. Because the moment you remove the skin, लगे कि यार इतना खूबसूरत आदमी अब ये कैसा लग रहा है. Yeah, it is true. Right? But this is like, take my word for it, as you will study these things, you'll fall in love. कि यार क्या चीज है human body. Means every time I teach medical, whether it is anatomy or it is anesthesiology or it is ortho, everything is like a marvel. Amazing things. So this is the thing. One important is splanknology. Splanknology. Upper limb वगैरह में splanknology won't be coming into picture. Splanknology is the study of organs. So that is when we'll be talking about respiratory system. The lungs will come into picture. Even heart, it is part of it, right? Then alimentary system, apne digestive system, right? Endocrine system, cardiovascular system. So all these are cardiovascular. Cardio means heart, vascular means vessels. So when we'll be going from heart, so this is where it is, I told you, heart to heart. Heart to heart means what? Heart to heart means it will be our practice that will start from heart. That is from heart, from the left ventricle, the aorta goes out. That aorta, it gives various branches. One of the branch, that is brachiocephalic, as it moves further, right? It will be going all the way into the form of axillary and then divide, radial, ulnar. Finally, will reach to the end, the periphery, right? Last arteries. They are arterioles. And then they will exchange oxygen carbon dioxide transfer, and then वहां से veins बनना शुरू हुआ, venules, and then they will return, come back, and then all the way they will reach to the vena cava, and from that vena cava it will land into the right atrium. Then from right atrium to right ventricle, from right ventricle it goes to the lungs, oxygen deoxygenation hua, and then once again the blood is put into left atrium or through mitral valve, and once again it reaches to left ventricle, वहां से aorta, whole circulation, right? This is important, and every time we'll be doing it so that you'll be having a crystal clear picture that for upper limb, which part is giving, which part of the vessel it is actually giving you the blood supply. Because there would be, iska fayda kya hoga when you'll be learning pathology. In fact, when you'll be learning medicine, there is a difference in the pulse, right? Arterial pulse, मतलब radial pulse और dorsalis pedis, पाँव में पल्स लिए, दोनों में फर्क आ रहा है, नहीं आना चाहिए. Heart pulse is because heart beats, right? तो heart blood को धक्का मारा, heart pushes the blood, and that blood which is pushed via aorta and it goes into the entire body. So entire body should be getting the same pulse. But if there is difference, yes, it is associated with certain things. लॉजिक वेरी सिंपल. कहीं पे एक जगह ऑब्स्ट्रक्शन है तो वहां पे पल्स धीमी आएगी, राइट? यू चेक द पल्स ऑन बोथ द लेग्स, यू फाइंड कि एक में वीक है, एक में स्ट्रांग है. क्यों? हार्ट तो एक ही है. देयर इज ओनली वन पंप. हार्ट इज नथिंग बट पंप. मतलब वो किसी को देना वो बात अलग है, राइट? बट बेसिकली फ्रॉम द मेडिकल एस्पेक्ट इट इज जस्ट अ पंप, राइट? व्हिच कॉन्स्टेंटली पुशेस द ब्लड इनटू द एंटायर बॉडी, राइट? हाँ. In one of the lecture I said also कि किसी स्टूडेंट को कहा था कि मैन कि when you are so smart, right? His question was कि should we give the entire heart? I said कि no, not necessary. I mean, you are very smart. So heart has got 4 chambers. So you have got the option कि एक को right atrium दिया, एक को right ventricle दिया, एक को left atrium दिया, एक चौथे को लेफ्ट वेंट्रिकल दिया. एंड स्टिल इफ यू वांट टू गो एट अ ग्रैन्युलर लेवल तो वाल देना शुरू करो, राइट? दिस इज द ट्राइकस्पिड वाल, दिस इज द माइट्रल वाल. किसी को एओर्टा देना हो, एओर्टिक वाल, राइट? पल्मोनरी वाल. सो दैट इज द थिंग. और ये तो मुझे इट इज स्टिल अ क्वेश्चन इन एवरी बैच आई आस्क दिस थिंग. मतलब वी से ना कि आई लव यू हार्टिली, राइट? व्हाट इज द साइज ऑफ द हार्ट? हार्ट इज आपकी मुट्ठी जितना, right? The size of your fist, was that is the size of the heart, correct? If you love someone immensely, so the bigger organ is so yaar apna liver. So why don't we say I love you hepatically, right? Liver size is this big. सबसे भारी organ, right? So when you say I love hepatically, so that is much more appealing. सामने वाले को समझ भी आना चाहिए ना. ठीक है. So coming back to this, right? So this is like splanchnology. It is the study of organs, which will come into picture when we'll be discussing thorax, right, and the abdomen. Head and neck, maybe there are some organs, right, like parotid gland or that thymus, etc. But still less. The maximum organs, they will be coming into thorax and abdomen. So that is where the beauty of splanchnology, that would be appreciated. This is most important part. Living anatomy. ये तो ठीक है. Initially we'll be dealing with cadavers. Digestion chapter was deleted from the NEET syllabus, so do we have to study it or come? No, those will not. Digestive system. See, I don't know about the NEET syllabus. Digestion chapter delete हुआ या नहीं हुआ? मतलब पेशेंट आया कि सर पेट में दर्द हो रहा है तो what would you say? No, go to some senior doctor. उनके कोर्स में डिलीट नहीं हुआ था, हमारे डिलीट हो गया. We'll be studying everything, irrespective of whatever the weightage of it is. The best example which I gave is ECG. ECG का weightage इतना कम है, and that should not occur, right? Weightage of ECG is practically 3 marks. मतलब आपने 200 पेज पढ़े just for 2 marks. We'll study it in more detail, complete detail. That is, you should be able to diagnose. And trust me, it is a pleasure, right? खुद को भी खुशी होती है और इम्प्रेस करने में भी मजा आता है कि आपने देखा और बोला करे हम इनको ऐसा है एंड पीपल वंडर क्या रहे वाह यार, राइट? एज सच कुछ नहीं है. इट इज प्योर साइंस, प्योर लॉजिक. एंड वंस यू विल अंडरस्टैंड इट ना, आप आंख बंद करो and images would start appearing कि हाँ, this is the myocardial infarction which is actually occurring at the base of the heart, or this is a very serious condition in which it is like the interventricular septum is getting affected. So just from the ECG, you'll be able to say some very amazing things. Right? And it is very easy. It is very easy.
So,
Yes.
so in splanchnology, what is endo?
Where? Acha, endocrine. I'll just write. It is endocrine. So in endocrine system, we'll start with the hypothalamus to pituitary, all the way to thyroid, to adrenals, right? And all the way down till ovaries in case of female and testis in case of males, right? So entire endocrine system.
Okay, so thank you.
So here it is when the patient is in front of you. These are the 4 things: inspection, palpation, percussion, and auscultation. Inspection is don't touch the patient, just watch. This is like a test. मतलब अभी तो क्या होता है कि when you go in the morning, right, for a walk, and then you see कि अच्छा ये आगे वाला जो जा रहा है, what should be the problem, right? ऐसे करके चल रहा है. Because he is unable to put the pressure, right? Unable to put the pressure on one side. So that's where that entire hip is tilting. Opposite side is trying to balance, पर वो ऐसे टेढ़े चल रहे हैं. So you can diagnose that only 2 things are possible. One, either he or she is having problem in the hip joint, or the problem is in the knee joint. The next thing which you walk it, can he take the steps normally? Yes, he can take the steps normally, 100%. It is the problem of hip joint. If you find knee steps are also small, so because that person is unable to put the load on knee joint is a weight bearing joint. So there are so many things in inspection where you don't touch the patient, just watch it. Right? Many of the interesting topics like portal hypertension. You just watch the abdomen, you'll be able to say so many things. You just watch the neck of the patient, you'll be able to say so many things. Nails, right? Aapke nakhun, right? Actually, I'll explain you with the images so that you can even watch yourself. Whenever you watch that your nails, they are absolutely smooth, white, proper, there are no ridges, things are good. If you find, कई बार पता है, इस कितने nails जो हैं, they are like this. यहाँ पे पूरा white हुआ है. They are with ridges, right? ऐसी line है. That carries the significance that there is some deficiency, right? So you can pick up those things at a very early stage. That is inspection. Second is palpation, when you are allowed to touch. Right? Patient tells कि मुझे पेट में दर्द है, तो you just touch, and then your fingertips, right? This area, that is the most sensitive area because the number of nerves, they are maximum. So you just touch and try to feel. So for when I'll be giving you training for this, I'll say try to touch your nose and feel कि कैसा feeling है. Right? Close your eyes, you try to touch your nose. Then try to touch your lips. So you'll find क्या difference है. Try to touch your head. Right? Try to touch your jaw because here there is parotid gland. So you'll find कि हाँ, or then put the hand and try to chew. You'll find the muscular movement, how tense they can become, right? Because if it is like if there is patient of tetany, right? So then the abdomen is like guarding rigidity, एकदम tight. You keep on imagining कि tight कैसा करके देखो यहाँ पे. Your hand should get the feel, right? Just you clench your jaw. यहाँ पे पहले अपना jaw soft रखो. यहाँ पे हाथ रख के clench it. देखो क्या tight होता है muscle. That is the power. When it is this size, right? This masseter is of this size. When the abdomen gets tensed, it is huge muscle. Rectus abdominis, they are huge muscle. When they get tense, then it is like a board, right? Itne tight hote hain. But your hand should really get that feel. That is what is called as the palpation. The percussion is कि जिसमें patient गालियां देगा यार मुझे मार रहा है, ये डॉक्टर मुझे मार रहे हैं, right? The thing is, percussion is change in the. See, you can't go straight away inside, so you'll be using this. Percussion is knock. इस तरह से you'll always be using this finger, long finger, and then you'll be tapping it, right? How? So when you put it over here, so in this region of chest, there would be the upper lobe of lungs. Lungs, they are carrying air, right? So अंदर से तो खाली ना, practically relatively तो खाली ना, liver जैसा नहीं ना, liver तो एकदम solid structure. So if you just put your finger over here and tap, you'll be getting a vibratory sound. But when you take it on abdomen and tap, you'll find a very dull sound, dull note, right? So when we'll be learning the percussion, right? The hand movement is very, मतलब ऐसे ऐसे नहीं, not from elbow, hand should not move. It should be like a hammer, right? Tuck, tuck, tuck. This finger should be snugly on that area, and then you tap. If there is fluid somewhere, right, you'll be able to judge. You'll be able to judge कि इसके अंदर organ है, इसके अंदर air है, right? You'll be able to judge that thing. So this is like one of the art. So sorry. So that is one of the things. And finally comes the most beautiful auscultation, right? When you really feel like यहाँ अपन doctor है, right? Stethoscope. Auscultation is when you hear. This hearing, it requires lots and lots of practice. Right? सबसे बढ़िया practice क्या? Listen to your own heartbeat. Right? Listen to your own heartbeat. When we'll be discussing auscultation, especially during cardiology, especially during when we'll be learning the cardiology. So there are 4 areas which are divided, right? There is a mitral area, pulmonary area, aortic area, and the tricuspid area. What are these areas? कुछ नहीं. दरवाजा बंद होता है तब आवाज आती है कि जब दरवाजा खुलता है तो आवाज आती है. मतलब
बंद होते तो
बंद होता है तब.
बंद होता है तो.
Correct, because it is like thack, right? So दरवाजा बंद, and then when it opens there is no sound. हाँ, you can say it like वो oiling नहीं किया तो च्यूं च्यूं, हाँ वो नहीं, right? But just दरवाजे की बात. Similarly, when the valves close, they make the sound. When they open, there is no sound. First principle. Second, गार्डन में पानी दिया है कभी? पानी की ट्यूब.
Yes, sir.
अब पानी की ट्यूब में से जब पानी निकलता है तो कोई आवाज नहीं होती, राइट? मस्त स्मूथ पानी जा रहा है. बट इफ यू पिंच इट तो कैसा कुर्र आवाज आनी शुरू होती है. टर्बुलेंस, समथिंग व्हाट इज कॉल्ड एज द टर्बुलेंस. सो एग्जैक्टली द सेम प्रिंसिपल. हार्ट में सिर्फ 2 ही चीजें, what you hear in auscultation. This is, I'm talking about cardiology. Respiratory system, वो बात अलग है. Cardiology, one, the heart beat, that is called as heart sound. So when we say loved up, there are four valves. There are four valves. Those four valves, they go in synchronization, right? दो बंद हुए, दूसरे दो खुले, वो बंद हुए, ये खुले. So they go in rhythm. So loved up, that is sound. So you need to know what type of sounds. लकड़ी का दरवाजा बंद हुआ या लोहे का दरवाजा बंद हुआ, same style, right? Their type of sound would be different. Best practice, listen to yourself, right? I'll tell you various areas, and then you find, this is because whichever the door is nearest to the stethoscope, its sound would be prominent, right? And second, when the blood is passing through those valves, they don't make any sound if it is going normally. But if the valve is constricted, right? For constriction, the word is stenosis. Stenosis means valve has become smaller. Which valve? Maybe say mitral valve, right? Mitral valve. Mitral valve कहाँ पे है? Mitral valve ऊपर जो है, there is left atrium, नीचे जो है left ventricle, right? So that is mitral valve. So when that mitral valve has become smaller, so when blood is trying to pass, so it will be turbulent, गोल 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 घूमेगा, and that will make sound. It is called as murmur, right? It is called as murmur. So all these murmurs, when is it occurring? When the heart is contracting or when the heart is relaxing? When the heart is contracting, just a minute. I'm so sorry. Just a minute, 1 minute ago. But now there won't be any interruption. So we were talking about the murmur part, right? So one is, okay, when the walls, if they have become stiff, so they won't be closing so delicately. When they are stiff, they'll be making more noise, right? At the same time, if they are stenosed, so then blood will be making some noise. So this auscultation is the game of sound, how the valves are working, how the blood is flowing. And from that, you have to really apply the logic and you have to come to the conclusion, along with your ECG, along with the rest of the sign symptoms. And that is what makes the entire cardiology so interesting, right? Then you'll be going into the details of whether you want to go for, say, USG, CT, MRI, angiography, digital subtraction angiography, PAT scan, SPAC scan, all those modalities they'll be coming at a later stage. Because when we say, okay, you tell the patient to go and get MRI, but then why have you said that? Because it is the expense of about 7,000-8,000 rupees. So you should be clear in your mind that why you are going for that particular test. Because you want to go for what's called as the DD, differential diagnosis. You are confused between two things, and you want to be very sure that out of these two things, what is the final diagnosis? That is what is called as the differential diagnosis. Yes, it is lumped up. That's true. Oh, regarding a hole in the heart, what you are telling is, right, that hole in the heart, you asked the question at a very right time. That is where the embryology will come into picture. So this is the heart. This is, right? And trust me, when I show you the heart, it is not that romantic. जो अपने मतलब ऐसा बनाते हैं ना, and that also in red color और उसमें से ये तीर, जरा भी ऐसा नहीं है, right? Heart is a very unromantic thing. So over here, when we say hole in the heart, it is nothing but septal defect. It is called as the septal defect. Septal means kya? Septum. Septum means it's the layer. Layer where kaha? These are called as the atria. Atria. So this is the right atrium. This is the left atrium. Right? I'll write as a LA. So in between ye jo, so what name should be given? Interatrial septum. Right? It will be interatrial septum. ठीक है? Interatrial septum. जैसे कहते हैं inter school competition between two schools. So interatrial septum is the septum which is between two atria. Now, if there is any hole, and why there should be hole? So many reasons. That is what we'll be learning in embryology. Because this hole is there. It was in me, it was in you, सब में. When we were not born. जब जन्म नहीं हुआ था तो वो 9 महीने, for those 9 months this hole was there, because that hole was keeping us alive. So this means that there is one very fascinating thing which is called as the fetal circulation. Fetal means when the baby is not born, तो तब circulation कैसे चलता है? How it works at that point. It is so mesmerizing, so amazing that again you will feel like saluting the God के boss क्या चीज बनाई है. Right? And then the moment baby is born, and why that first cry, the moment baby cries, so those lungs, they open. When the lungs open, so that means कि यहाँ पे जो pressure था, that pressure is released. That pressure is released, so instead of blood which was going like this, that blood starts going like this. That means now left atrial pressure is more. Left atrial pressure will push this valve and it will close it, right? And the normal adult circulation starts. But जब तक जन्म नहीं हुआ था, तब तक these lungs, they were dipped into the mother's fluid. Not patient. Baby cannot breathe, right? Because the lungs, they are filled with fluid. So that oxygen which is coming by the umbilical system, right? So from the mother. So that's why this, when it comes over here, it has to be straight away bypassed to left atrium and it goes into the circulation. This area is absolutely non-function, non-operable. But with the first cry means what? When the lungs open up. When the lungs open, so that means now there is air. That means blood vessels open. So that means this right ventricle, it will get a chance to fill the blood. यहाँ से blood आया, right? So यहाँ now the blood is rushing over here. तो यहाँ pressure कम हो गया. And that is the setup. this is how it goes. This I explained you in very brief, but when we'll be discussing this fetal circulation at length, yet with every artery, with every nerve, and then I'll show you that when there is persistent, ये बंद नहीं हुआ for some reason. So that is what is called as the ASD, atrial septal defect. Defect. So for that, we need to go into the depth of embryology, why it occurs. Similarly, there can be VSD. Okay, this is the in between two ventricles, right? So this is interventricular septum. So when there is problem into this septum, it is called as the ventricular septal defect. ASD, VSD, these are all commonly known as hole in the heart, right? Hole in the heart. So heart has got this thing. So for that, we'll be learning the embryology. Now for this is prenatal development before birth, right? What are the developments? One, in which we'll be very much interested, that is called as the ontogeny. Ontogeny means development from zero, right from the first cell. Here comes the sperm, here comes the ovum, they unite and the process starts, right? We'll pick it up from there. So the way I said that when we'll be discussing embryology, we'll be starting from that point all the way till the delivery of the baby. So that's how that entire journey, once you know, right, it will solve many of the problems, what is called as the congenital defect. Congenital defect means some things which are right from the birth, right? Defects which are right from the birth. Kushmin, you asked, what if baby does not cry? Worst thing. Baby has to cry within first 1 minute. नहीं रोया तो मारो खींच के उसको. Maro, right? And when you slap on the hips, so that generates so much of pain sensation, right? That brain releases large amount of impulses, and those impulses, they go even to the respiratory system. Our respiratory system is governed by all those muscles. So तो पता नहीं चलता अभी आप और मैं breathe कर रहे हैं. But when the moment if there is less oxygen, तो कैसे breathe करते हैं? Right? पता चला? Right? So that is
Yes.
when that slaps, so that the pain sensation, why मतलब किसी ने मारा तो अपने बोलते आ करते हैं, right? Because it generates so much of pain sensation. So during that, it is baby has got no other alternative but to cry, right? And that cry, जो कहते हैं ना कि जिंदगी में एक ही बार ऐसा होता है कि जब अपने मीन्स पेरेंट्स, फ्रेंड्स, रिलेटिव्स, मतलब जो भी आपके साथ हैं, वो बेबी रोया तो सब खुश हुए. हाँ, बिकॉज वो अपने होते हैं. फॉर रेस्ट ऑफ द लाइफ जब आप रोते हैं ना, तो वो अपने नहीं होते, बिकॉज दे आर हैप्पी. दैट्स व्हाई इट इज सेड कि दिस इज द बिगिनिंग ऑफ द लाइफ, एंड व्हेन यू क्राइड, ओनली योर रियल souls which were with you, they were happy. बाकी की जिंदगी, when you cry, people are happy because of their selfish reason. Right? So this is the answer to one of the emails जिसके अंदर मैंने बोला था, don't be carried away by what others would say. People are very happy when you are दुखी. बाहर से बोलते हैं अरे यार ऐसा हुआ तेरे साथ, right? And वही चीज when they talk with someone else, पता है उसके साथ ऐसा हुआ. That sentences remain same, tone changes. So that is development from zero, right from the beginning. There is another word which is called as the phylogeny. Phylogeny is, ठीक है, it is like evolution. कि पहले आदि मानव ऐसे चलते थे, then they started walking like this, then the limbs, upper limbs, they become shorter, and the body started becoming erect, वगैरह वगैरह, right? The theory of evolution, how it increased, or some organ increased or decreased. So for example, appendix, right? Appendix. So so this is the esophagus, and then comes our stomach, right? Then stomach 2. There is which is called as the C loop of duodenum, C loop of duodenum. Then there is jejunum, ileum, all those small intestines, right? Long thing. And then they finally reach to this portion, which is called as cecum, right? This is colon or the large intestine. It is this portion, which is called as appendix. Appendix is called as the vestigial organ. Vestigial organ. Because function of this appendix is to digest raw meat. So if you see tiger, cheetah, lions, so their appendix are big. But over humans, now we don't eat any of such things, right? So the appendix is shrinking. It is becoming smaller and smaller and smaller. Right? So that is what we'll be studying in case of phylogeny. Then comes the surface anatomy. Patient tells कि सर पेट में दर्द हो रहा है, ठीक है? Put the cut and open and बताओ कहाँ पे दर्द हो रहा है. We can't do that. We can't do that, right? From the surface, when you press the abdomen, right, you need to create a picture of what exactly is the structure. So whether you do percussion, right, you should know that when you are doing percussion, so then this is the liver which we are handling. This is the gallbladder, because gallbladder will be having fluid. When you are percussing on stomach to khali hai, right? Stomach is empty. There is air, stomach air. So its sound would be different, right? So that way, if you know that what is the surface representation of that specific organ, so that is what is called as the surface anatomy. Cadaver is there, and in exam, you might be said that, okay, draw the surface anatomy of left kidney. So you have to immediately ulta kar dena padega cadaver, because kidney, right, in the entire body, so kidney is the retroperitoneal structure, right? Don't worry much, but just remember kidney is a posterior structure. Piche aati hai, right? In front, so there are all digestive systems, right? So that is where you will be writing. Let's say jisko suppose stone ho, so you know they complain कि यहाँ पीछे दर्द हो रहा है. It is not the back pain. It is the side which, right, side of the back, right? That is where the pain occurs. So surface anatomy will help you immensely. It will help you immensely in your diagnosis, because when the patient tells him where exactly the pain is, and you'll be able to decipher, okay, these are the 3 or 4 organs where the pain can occur. Right? What type of pain? So this is a continuous pain or continuous pain. That means it is not only related to nerves, right? There has to be something कि जो constantly pressure दे रहा है. When patient tells नहीं जब मैं सो जाता हूँ तब pain चला जाता है. Oh, that means it is getting relieved, right? Because pain is nothing but it is like a sensation which is carried to the brain, and it is a defense mechanism. If I get injured, so then if there is pain, so I won't be using this hand. I'll pamper it कि नहीं यार दर्द हो रहा है. Right? So automatically rest is there. If you give rest to that area, that will start healing and it will be fine. So pain is a defensive mechanism, and that's what we have to really understand. So this will be important for the differential diagnosis. Differential diagnosis means possibility of diseases, what can really occur to the patient, and you decipher कि हाँ ये है नहीं है ये है नहीं है. Finally, when you come to the end, you go for the test and you confirm it. Correct? Then comes the radiological anatomy. In radiology, say someone asked this question that in radiology, do we have to study everything? Yes, you have to study everything. You have to study ortho also, you have to study gynec obstetric also, because when the patient would come, right, every pregnant patient, they will come to radiologists for the ultra high definition radiography, sonography. Reason? Your responsibility as a radiologist is to diagnose is this baby okay? That report is so vital, because you'll be examining the baby in depth about his every chamber, his every wall, and if you miss, it's a grave mistake. Because if that baby is born, and in case if anything is missed, so then this is like crime. It's like a crime. Right? That's why that is the responsibility. Similarly, when on an X-ray you find a thing and you go for CT scan and you write a report, surgeon will open up the patient. He'll say, radiologist has sent this report and it is acute abdomen, you have to open it, opened, right? Surgery is performed. So that's the reason those who are telling that, yes, in radiology, yes, you have to study a lot. You have to study because ortho, yes, surgery, yes, medicine, obstetric, gynec, everyone would come. Accidents, yes, right? So you have to study all the subjects. X-ray, CT scan, MRI, magnetic resonance imaging, right? This is one of the most wonderful technology achievement by the man, right? MRI. So all of them, they are called as a cross-sectional anatomy. It is like you just take a slice of the human body and then you watch what's the situation, right? So it is like slicing a human body. So as if you are taking a cut. No, these are virtual cuts, right? And then what you are watching is various images sectioned at a 5 mm. So you are watching every structure. So here I'll be giving you the practice. First, I'll teach you. Say, for example, we take thorax, right? So then I'll show you various sections. One full day will be only for that. One section here. Now, this is the section, this level, right? Right now, I'm not confusing that at what level of vertebra, this, that. But when we'll be learning actual MRI or CT scan, so yes, we'll be discussing even that also. Because we would have said this is angle of Louis. Angle of Louis, one of the most crucial angle, because that is the angle. Say, if I draw the aorta, right? This is the angle or level of angle of Louis, right? It is called as, no need to write, no need to remember much, but just for the understanding. This is the angle. What is this angle? You can feel in yourself because jo apna chest bone, right? Chest bone. The upper one, it is like a manubrium. Niche wala sternum. Manubrium means dhal. This is like a talwar, right? So its shape is like this. Its shape is like this. And this ridge, it is called as manubriosternal ridge. Manubrium ये ऊपर वाला मतलब ये the moment this is यहाँ पे right, that is trachea. बस उसके नीचे immediate bone, feel it in yourself, that is manubrium. And as you go down जरा सा 1 inch and you will get this elevation because वहाँ पे दो bones they fuse and they make a ridge. This ridge is called as angle of Louis and it is this angle. So if you follow this angle, so internally, this is the point from where this is called as the arch of aorta, right? The most important artery. Over here, it is the left ventricle. So left ventricle में से arch of aorta comes out. Arch of aorta goes back, right? शुरू आगे से हुई पीछे जाती है and then it will go all the way back. So it goes like this. So this is the point where the arch of aorta begins and this is the point where arch of aorta ends. And from this point onwards, it is called as the descending aorta. Descending because it is going down. All these things, right? No confusion. But when we'll be taking the CT scan or MRI, so at this highest level, we'll see this aorta as कैसा दिखेगा एक caliber ऐसा goal, right? When we go at this, but what about at this level? At this level, there would be two tubes. Make sense, na? मतलब tube is like that. Over here, you have cut it like this. यहाँ पे एक cut, यहाँ पे एक cut. So it will look two. So this is like how you have to visualize the things in 3D, right? So these are all sequential cross-sectional examinations, so which we'll be studying. So that way, once you understand it, just by looks at it, immediately you will know okay, this is coarctation of aorta. Coarctation means kya? Aorta is narrowed down at one point. Now, if you have seen normally, and instead of such picture, because see, this is एक tube and that tube is going like this with the same caliber, right? But if यहाँ पे this tube is like this and यहाँ पे if it is like this, guaranteed problem. That means watch the above section. At what level it is getting narrowed and why it is getting narrowed, whether it is a congenital defect. So that means with patient को देखो, age छोटा बच्चा, right from the beginning problem हुआ है. Okay, things are different, right? Things are different. So that's how you come to the diagnosis, how you have to really create the whole picture visually. Okay. So that is what is called as the cross-sectional anatomy. Cross-section, as if you're taking the sections of the body. Then comes the applied anatomy. All these katha, they finally boil down to clinical practice, right? How good are you in diagnosis? It depends upon this understanding. No one cares, boss. No one cares कि आपके कितने मार्क्स आए थे. Patient is interested in what? मुझे ठीक कर सके? Yes, no, बस. That's it. I'll not guarantee that you'll be getting a gold medal. But yes, your diagnosis, that would be the fantastic thing. And it will give you so much of satisfaction, right? So that is the applied anatomy, which is combination of everything. Then study of, this is anthropology, a very special science, study of fossils. कि डायनासोर में ये ऐसा था, उनका ब्रेन इतना छोटा था because head cavity is only this much, this is the tail, वगैरह वगैरह. Right? Histology, a completely new word. Histology is study of tissues under the microscope. So first we'll be studying. I got all the slides of the entire body, every organ, including the various diseases. When we'll be discussing histology, I'll be showing you, say, for example, normal hepatic structure, that is liver structure. And then I'll also show you 1 or 2 slides of the pathology of it. Okay, what if there is a development of cancer? What happens? How it really looks like? So that is the pathology. So in histology, you see both normal and abnormal. Why you do it? You must have heard biopsy. Biopsy. On CT scan, you find that patient is having some mass. Now that mass could be benign or it could be malignant. Benign means क्या? बरसों तक वो वहीं का वहीं पड़ा रहेगा. It is well encapsulated. It won't be spreading to any other part. Just it can cause compression symptoms. वो कहीं पे किसी दूसरे organ को pressure देगा. You get the pressure symptoms. But otherwise it is not spreading. It is slow growing. वहीं पे पड़ा है. Malignant, it can spread very fast to other organs and you need to treat them very fast. Pata kaise chale? You have to take the small amount of tissue and see it under microscope. That is what is called as the histology. Right? So we have got 10x, 20x, 50x, 100x oil immersion. So you are watching those structures to that resolution. Genetics, the most fantastic, right? So many things associated with it. But this I always say, जब कभी depression आए, whenever you feel like नहीं यार, people are much better than me, मैं तो कुछ नहीं है, right? Think it like that the day you were not even born, there was only one ovum, and then there were more than 100 million sperms, and every sperm was क्या बात करते हैं क्योंकि बॉस I am the powerful, right? अपने जाके ये खेल करते हैं, right? And there was such a stiff competition. Out of those 100 million, only one was successful and who was able to fertilize this ovum. And who was that sperm? You. Right? So competition तो यही से थी ना यार. 100 million में से you were the only one who was the most powerful, most fantastic, with the highest strength and who succeeded. So that's why I say you are the best right from the beginning here. अब क्या रोना जब इतनी बड़ी कंपटीशन 100 मिलियन में से 1 पॉसिबिलिटी, ऐसी कंपटीशन तो पूरी जिंदगी में कभी नहीं आएगी कि just 1 out of 100 million. So do remember this.
Sir?
हाँ बोलो ना.
So just by looking at the tissue studies, we can detect the cancer, but we can't detect whether it's malignant or the benign tumor which we are talking about.
अरे my
right?
dear, you can detect it very effectively, whether it is malignant or benign. I'll actually show you those slides. Guaranteed you can say, right? Whether it is malignant
Okay.
or benign, because the structure is completely different. That is what we'll be studying in pathology. Okay, when it is malignant, what type of situation it is, and then when you combine it with the CT or the MRI, right? As you have asked the question, CT is what I say. CT is like anatomy. In CT scan, computerized tomography, tomography. Tomo means to cut, graphy means to see. And because it is done by computer, so that's why it is called as the computer tomography, CT. You are just watching the structure. You cannot make big judgments about how it is functioning. In case of MRI, magnetic resonance imaging, where the tissue is exposed to heavy magnetism, because of magnetism, and all the electrons which are randomly jumping, they all are aligned in one fashion. Right? You must have seen that when you put the magnet, तो कैसा कंपास में नीडल कैसी एक ही डायरेक्शन में आ जाती है, because it is like a magnet which is floating, which gives north pole, south pole. So exactly the same way, all the electrons, they come into one position. Now, because the magnetism, and this magnetism is tremendously powerful. This is used in the term used, it is called as the Tesla. Tesla is the strength of the magnetism. So when such strong magnetism is imposed, this is how those electrons, they are like vibrating, right? And then that is at the T1 image, you just switch off that magnetism. So immediately all the electrons के जैसे वो school छुट्टी आ रहे, hey, भागो भागो भागो, right? All the electrons, right? Once again, they will go into their original fashion. In the process, जैसे वो बच्चे स्कूल में से निकलते हुए आवाज करते हैं, right? So you close your eyes and you'll hear कितना आवाज हुआ. So if there are less students, so there'll be less noise. If there are more students, there'll be more noise. That is what is called as the signals. You listen to those signals and you make a judgment. Exactly the same way you listen to those signals by those coils, right? So those coils, they just catch those signals, and then those signals, by the Fourier analysis, they are on the computer, they display the images. So जैसे पानी जो है, it takes more time to get heated and it gets more time to get cooler, right? While land,
Yes, sir.
it gets heated fast, it gets cooler fast. That is the reason if you are living in Mumbai, you'll constantly be getting the breeze, because daytime, the heat is more onto the land. So there will be the wind from land to ocean. At night time, land will become cooler, but ocean is still hot. So again, the wind, right? So same principle, very similar principle is in case of MRI. So MRI will tell you whether the structure is dried up. So for example, in case of spine, you'll be able to, I'll actually show you those images where you will be diagnosing after explanation of that this is what has happened in T1 weighted, this is what has happened in T2 weighted, and then you say that this is a desiccated disc. Spot diagnosis. Spot means you see it and then you say it. Right? So
Yes,
that is
sir.
how. So same way, even in case of malignancy, whether it is benign or malignant. So in malignant, because it can spread to, the capsule will be very weak or it might not be present. In case of, say, benign, wonderful capsule, everything will be occupied. So that's why it will be creating some pressure symptoms also. So all these things will be able to see. So then comes the history. When we say it is his story, the story of the patient, right? This is Hippocrates was considered as bit of thoda Purana, right? Father of medicine. Hippocrates, right? 400 BC, before Christ. Tab se. And the oath which is called as Hippocratic Oath. Hippocratic Oaths, as such, it was designed by 60 scholars. They are anonymous, but they designed everything. And in which they say that once we come into practice, we won't be doing any illegal abortion. We won't be doing euthanasia, killing the patient. Like so many rules. That is what is called as the Hippocratic Oath. It is important. It is important. आप में से किसी ने ऐसा पूछा सर आप कार कौन सी चलाते हो? Well, it is like say 2000 में I took my first car, right? That was a sports car, very old car, right? And it was Palio from Fiat company. And then in 2012, I got my Scorpio, and still I'm using it. Bus. So this is the thing. The answer to your question, I want to buy Mercedes. I don't mind. You buy Mercedes, पर ईमानदारी से. And at times it happens. Like थोड़ी ईमानदारी रखोगे तो you might not be, जैसे multi-millionaire or multi-billionaire, but satisfaction, नींद बहुत अच्छी आएगी. That is very true. Chalo, coming back to this is the Plato. Plato, he was another great fellow, right? On the island of Kos, now which is called as the Turkey. So that is where he used to give training. He was very much criticized because there were two concepts, there were two schools. This is called as the Asclepiad. Asclepiad, this one. Asclepiad means what? Where the doctor, he would consider himself as God. While the second one, which is called as the Asclepias. Asclepias means that we are healer. बस ये याद रख लेना. Healer. We are healers. मतलब what's the point कि कोई दुखी हो रहा है तो उसको ज्यादा दुखी करो? No. Right? So this is the thing. So no ego, कुछ नहीं. Right? Keep it all aside. Father of anatomy, he's called as the Herophilus, once again 300 BC. And the names which were given by him, hyod, duodenum, prostate, आज की तारीख में भी these are the names which are used as it is. Then one of the very, very wonderful person, Leonardo da Vinci. Leonardo da Vinci, it is said that his curiosity level, that was at its peak. A very standard sentence or very standard thing, very, very impressive is that if you develop in your life, if you develop the curiosity of Leonardo da Vinci, and if you develop your mathematical ability to the equivalent of Albert Einstein, then you will be miles ahead as compared to others. Right? Leonardo was very good in painting, very good in sculpture, he was very good engineer, he was very good in medicine, right? So all these things, it is like worth following him, right? There are some very good books. If you want, I'll share it with you. But amazing. He's one of the finest creation, Mona Lisa, right? In Mona Lisa, and then there are so many mysteries associated with Mona Lisa regarding this bridge and 3 stones and so many. I mean, if we'll start discussing it, then the entire lecture will go on Mona Lisa only. But the beauty of this is that they say that these eyes, the eyes is like you watch, it is into British Museum, London Museum. You watch Mona Lisa from any of the angle and you will feel like she's watching towards you. And actually, if you go into the depth, the emotions, they keep on changing as you change the angle. From absolute loving emotions to observation. Right? That is what is called as the speciality of Mona Lisa. Another painting, The Last Supper. This is also one of the very, very famous painting in which Jesus is shown with these 12 apostates. One is missing because it is again considered that it was that apostle who finally killed the Jesus. Right? This painting is in Milan, Italy. In this PDF only I put it at the list. Dan Brown, Da Vinci Code, my favorite book, right? If those who have started reading, if you want this book, I'll put it into our good books folder, right? Wonderful book. Khub maja aayega. And Da Vinci Code pe to even there was a movie also. Tom Hanks, Robert Langdon, right? Professor Robert Langdon, he was, I think, Da Vinci Code. He gave the concept. This is, just a minute here. This is third painting. This was shown even in that movie also. This is called as the Vitruvian Man. Now, Vitruvian Man is not only a painting, it is about the correct proportion. It is about the correct proportion. Right? And what that correct proportion is something जिसके लोग मरते हैं. These Hollywood, Bollywood people तो मरते हैं इसके लिए. This is what is called as the golden ratio. That is when you are standing. So how good will you be looking? It depends upon this golden ratio. Right? So what golden ratio is? It is this. Right? Now, this is not present in this. We didn't discuss in detail in the lecture, which is on YouTube. But I thought, chalo, you guys are, your question answers, they are so good. So, ye likha. This is a ratio. From P to O, this is A. from O to Q, this is B. So the formula is A upon B. A upon B, right? It equal to A plus B upon A. And if it is coming to 1.618, this is called as the phi. So then that is called as the best ratio. Best ratio. So if someone's upper body is like this and the lower body is like this, in this ratio, so then they look very attractive. Very attractive. Now, we can't increase or decrease the length of our legs, right? So that is not in our hand. For the males, it is like that's the chest, this is the abdomen. So that is into our control. Again, the bell. I'm so sorry. Just 1 minute. Coming back to this. So this, people are having big abdomen, big tummies. So this is the ratio. Say, keeping the abdomen under control and making the chest powerful, that is in your hand. So when this ratio is maintained, automatically you'll start looking very attractive. In case of females, many of the females, they go for so many surgeries, right? This Bollywood वगैरह, just for this ratio. It is not easy to maintain this ratio. But even if you reach near to that ratio, it has been, I'll show you that image also, Vitruvian man, where it is said that what should be the correct ratio. Now, this ratio, it follows even onto your face, right? That's why people go for plastic surgery. They say that they make their nose small, they make their jaws more bigger, right? Then there are some fillers, fat fillers to make the shape near to the golden ratio. So that is what is called as the golden ratio. This based on, it is what is called as the Fibonacci sequence. Fibonacci sequence, this is like, say, this is how it follows. Very easy. Even in nature, in sunflower, you'll find that there are circles. It follows this sequence. So starts with 0. Next is 1. 1 plus 0 is 1. 1 plus 1, this is 2. 2 plus 1, this is 3. 3 plus 2, this is 5. Then 8. 8 plus 5, so this is 13, right? So that's how it keeps on going on and on and on, right? From 13 plus 8, that will come to 21. 21 plus 13, so that will come to 34. 34 plus 21, that will come to, say, 55. 55 and 34, so that will become 89. And that's how it goes on and on and on. This is applicable in genetics. This is applicable even in honeybee, because in honeybee, right, there is a drone, that is a male, and then there is a queen bee. So a drone is born, right? Drone is born. Drone gets its entire DNA from the queen, right? So if you follow that entire pattern, sunflower, right, its petal, even the trees, so when they are number of leaves, they all follow this Fibonacci sequence. So much so, even in stock market, right, there is something what is called as the Fibonacci retracement. So that means if it crosses certain level, so then stock will go up, or if it doesn't cross that level, it is likely to go down. This is what is called as the law of probability, and it is one of the most powerful sequence in the world. So this also, you will be surprised. Here it is, 5 divided by 3, right? You start taking these sequence, 5 and 3, it is 1.66. You take the next sequence, right? And we jump onto this 21 by 30. So again, it is 1.61. You move on to the next sequence, 55 by 34. Here it is, 1.617. You still move further, 89 by 55. It is 1.61818. See this 1.618. So closer to 5 as you proceed. This is Fibonacci sequence. Imagine the level of Leonardo that he came across this and he figured out that how it affects the face, how it affects the entire body. One of the fitness things, right? You take the measurement of the chest and then you take the measurement of your waist and then chest to waist ratio. If you maintain this, you don't have to make any effort. You automatically will start looking so good, right? And then there are so many things associated with it. What is called as the concept of pheromones. Pheromones means the scent and the aura of your body towards the opposite sex, right? So this is again a very powerful science. Right? We'll discuss it when we'll be discussing the pelvis or the endocrine system because it is associated with that. So this is the Vitruvian one, correct proportion, and we talked about it, right? Moving on to, yes, Urula, want to ask anything?
Sir, why was there a need for golden ratio? Because science appreciates diversity, na?
Huh? Science appreciates diversity, but in that diversity, this was figured out that, see, this is the nature. That's why it is also called as the natural law. Natural law. And because this Fibonacci is one of my favorite topics, so then we'll be studying genetics now. So I'll show you that what is the amount of DNA which gets transferred to the kid from the parent. Even there is Fibonacci sequence in that also. Fibonacci sequence, it is applicable even the mechanical wear and tear. It is applicable to even the moving of the wheel, with what force and how much it gets converted. It is also applicable to nuclear reactor, that is amount of energy which is utilized and how much energy it is produced. This thing will follow. And when I tried to implement it in the equity market, share market, it was another.
So this means this is ideal. This is supposed to be the ideal.
Ideal. Yes. Now that's what I said. This is ideal, right? Now, if my legs are long, and if I'm not falling into the, I can't cut my legs. No? I want to reach to that golden ratio. No, things which are in your hand. But what I'm telling you, Urla, is some things are under your control. If you follow that, so it is not only that person would look amazing, but at the same time, your fitness level would be very good because it will take you more towards the nature and you'll be more and more, say, going towards the perfection. Things which cannot be changed, they cannot be changed, right? Say, for example, they say that Hrithik Roshan, right? Hrithik Roshan's face, now it is a God-given gift, right? We can't say that, nahi, mujhe bhi aisa face chahiye. No, this is a God-given gift. So they say that he is like a Greek god. Now, because it is a God-given gift, but he worked on his body so that rest of his body is also going towards that proportion. Now, whatever the looks God has given to us, but at least we can work on others. Because over there, so they even measure that nose and the lips right? This is such a big science. I mean, the lips, why females they apply lipstick on lips, males क्यों नहीं लगाते? There is the world's biggest industry is cosmetic industry. Weapons उसके बाद आते हैं. The world's biggest industry is cosmetic industry. It is bigger than weapons. The entire, all those answers, they are lying into this Fibonacci only. Right? Chalo. So on to this Henry Gray, Gray's Anatomy, which is a reference book, right? And there is another book. This book, I think you should really buy. Cunningham Book of Dissection, Cunningham Manuals of Dissection. In this, every organ, every part, it is dissected, right, with the description. And plus there are so many images. So that will be a big help. Then CT, MRI, PET, SPACT. SPACT is positron emission tomography. It is called as the positron emission tomography. And if you want to go at a very granular level, you go for SPACT. single positron emission computerized tomography, right? Where you are specifying the frequency and then you are taking the section. I'll show you all the images and then it will be much more easier. This is language of anatomy, right? In this language of anatomy, the entire journey started way back, right? 19th century, and it was called as BNA, basic names of anatomy, basic names of anatomy. But still, there are how many terms? There were 30,000 terms. Now it has crossed 1 lakh. Do you have to remember all of them? Absolutely. Will you be able to remember it? Very easily. Because there is a pattern. Once you remember the pattern, it is like a chessboard. If you know how the rook will move, then that's it. Then the movement of that rook, the movement of that pawn, right? So that pawn which will be moving one step. To kill, it will be going like this. But that you have understood. Now, once understood, it will make the same move on every square of the chessboard. Medical is like that only. So this BNA, basic names of anatomy. Basic names of anatomy, right? It is in English. 6 rules. 1, you talk about upper limb, you talk about lower limb, any part, but in that part, there has to be one name only. It should not happen that in abdomen, say, there is one liver and some other organ is also called liver. No, it cannot. It should not and it will not happen. So in one part, there is only one name of a specific thing. All these names, they are derived from either Greek or Latin. Either Greek or Latin. Then we'll be going for what is the length. So is it, say, when we say seps means head. We say this is biceps. Biceps kyun? Bi means 2 and head means it has got 2 parts. So because it has got 2 parts, it is called as biceps. When it has got 3 parts, it is called as triceps, right? Biceps, triceps. Then this I have added to it. Whenever there is any memory sign means you want to remember. Just during our anatomy discussion, we'll start putting this star. Star means we'll always consider that this is important and we must remember it. During nomenclature, everything should be related, right? So that means in the thigh, when we say that name of the bone is femur, right? Name of the bone is femur, okay? Anything which is related to femur is called as femoral. So that means we know that this is associated with the femur, right? So there would be femoral artery, there would be femoral vein, there would be femoral nerve, similar names, right? So that we can decipher that these are the structures which will be traveling parallelly. Similarly, there'll be few adjectives. Adjectives are, say, our core muscle, right? When we say core muscle, you are standing straight because that's the spine, and then there are 2 big muscles which are holding the body, and that muscle is called as the psoas, P-S-O-S, psoas, S-O-A-S, psoas muscle, right? But there are 2. One is the big muscle, psoas, and then there is a small muscle which is just underneath. So big muscle will be calling it psoas major, and the small muscle will be calling psoas minor. Same way in chest. The big muscle which is forming the chest, shape of the chest, that is the pectoralis major. But if you really peel that, underneath there is a small muscle, which is called as the pectoralis minor, right? So all these muscles, they are important from that perspective. Now, say as we are discussing this, as the age increases, when they say that female starts losing their beauty, that as the age increases, who is responsible? They themselves. They themselves. These muscles, pectoralis major, pectoralis minor, they are so crucial. For males, they are very crucial for the development of your proper chest, right? So when we'll be discussing these things, for females, it is very much important so that their beauty of upper body, that remains wonderful, right? That's why those exercises are needed. And for males, it is important because that will be generating power, right? So that's why being a doctor, being a medico, when you do any of the specific exercise, if you do it properly, so yes, they will be leading to development of these proper muscles. Some muscles which are on surface, these psoas muscles, they are very deep. But if they are powerful, it helps you a lot, even satisfying your partner. Here comes another group of muscles. These are the muscles: superior oblique, inferior oblique, superior rectus, inferior rectus. These are the muscles of eyeball, right? Rectus. Whenever we say rectus, rectus means straight. These are the straight muscles, right? So here is the eyeball. Here is the eyeball. The muscle which is like this, straight muscle. The muscle which is here, straight muscle, straight muscle, straight muscle. So it is above superior, below inferior, and that's the eyeball. Right? So that's how it goes. 1968, there was first publication of Nomina Anatomica, the name used to be used in anatomy. So they said that first we must understand that what will be the position of the body with respect to, because if I say right side, whose right side? Mine or yours? Right? Similarly, when we put the patient into CT scan, so then when we see the image, so we find which one is right, which one is left. See these are because X-ray can be seen on both the sides. The thing is, you are watching the patient from his leg side. So you take a section and then straight away watch. Immediately you'll know that which one is right and which one is left. Simple. You're watching the patient from the leg side. So when we'll be discussing CT, MRI, we'll start from this level. So here in case of Nomina Anatomica, first let's set the position. And this is one of the favorite question in Viva. They ask you this thing. Lavishly, they ask you this question. That what is the anatomical position? Do it. Right? They actually said, karke dikhao. So it is like person is standing. This is one. Eyes are straight, watching straight. Right? Then arms by the side with palms facing front and feet together. These are the points. 1, 2, 3, 4, 5. These are the 5 points which you must say. Right? You must say. That is the reason when we'll say if the hand is like this, so in anatomical position, when the hand is like that, so then what is medial, what is lateral, it will make a big difference. If the hand is like this, right? If the hand is like this, so then I say this is anterior and this is posterior. Haath ulta kar liya to ye anterior ho gaya, ya aage ho gaya. Nahin. It has to be anatomical position. Everything with reference to anatomical position. And another thing, what we said is over here. Rectus means straight. So then the muscles which are not straight, they will be oblique. Correct. They'll be oblique. In our eyeball, there are 6. In fact, one more that is called as the levator palpebrae superioris. So these are the muscles which are present. Spine, lie on his or her back. When patient is lying, so patient should be on the back, right? So this is called as supine. This is prone. Prone means ulta. When the face is down, patient is sleeping on face. Supine, patient is sleeping on spine. Lithotomy, this is a position that is for the delivery of the baby. When with the straps, both the legs, they are raised. And this is the position when the baby is to be delivered. So this position is called as the lithotomy position. Finally, the planes. That's the body. So when it is said that, okay, this is the sagittal plane, this is the coronal plane, what are all those planes? Right? So here it is. We start with the top view. Ye kya hai? This is head. Watching the head from the top. Uppar se, right? From top we are watching. Watching from the top. So then this line which is dividing the body into anterior part and the posterior part, that is called as the coronal plane. How to remember? From the crown. Crown is worn like this, right? So this is the crown. This is the crown. This plane, which is dividing the entire body into anterior part and the posterior part, it is called as the coronal plane. So now it becomes easy that when we say, okay, take the coronal sections. So this means that here is the head, right? And we want coronal sections. That means machine will start taking sections like this. Tuck, 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 tuck. From anterior, it will go posterior, right? So pehle nose se shuru kiya and then it is cutting, cutting, cutting all the way till the back. So that's how it really goes. This is the second plane. There are only 2-3 planes. दो ही plane है समझने के. So one is this coronal plane, and the second one, which is called as the sagittal plane. Sagittal plane divides the body into right side and left side. Right. So this is right from the beginning, right from the center. What it really goes divides into sagittal. So here it is the top view. When we are doing this, this is the coronal plane, right? And this one is the sagittal plane, right? Third one is the horizontal plane, matlab entire body, and we slice like this from top to bottom, right? So which will divide the body into upper part and the lower part. So that is called as the horizontal plane. That's it. Within these planes, the entire body is defined. Bas, that's it. Now comes these terms. So this is the ventral. Whenever we say ventral, that means anterior, in front. When it comes to dorsal, that means it is posterior, behind. Superior, name itself tells, above. Inferior is below. Cranial means head. It is towards head. Caudal, it is towards tail. Right? So if we say that this is the liver and these are the kidneys. So then how the things are? Liver is towards the cranial end. Liver is cranial to kidneys, right? Kidneys are below. They are caudal. Caudal means they are near below. Right? Superficial deep, self-explanatory, superficial deep. This is worth remembering. Whenever we use the word ipsilateral, IPSI lateral, ipsilateral means these two structures, A and B, they are on the same side, whether it is right side or it is left side. So for example, when we draw kidneys, right? This is kidney and this is the ureter. This is opposite side kidney. This is the ureter. Both of them, they will be landing onto the urinary bladder. So kidney and the ureter, they are ipsilateral, correct? They are ipsilateral. They are on the same half, either right or left. But both the kidneys, they are contralateral. That means one kidney is here, other kidney is on the opposite side. So they are on the opposite side. So that is what is called as the contralateral. Right? Very easy. Ipsi means same, contra means opposite. Similarly, this is medial and lateral. This is the concept which will be coming across again and again. समझने के लिए एकदम easy. What you have to do is just draw the central line. Central line. There are two structures. This is A, this is B. Right? This A is more near towards the central line, so that's why we'll call A is medial. Or medial to what? Medial to B. This is a comparative statement. Comparative statement. With respect to one to each other. Now, watch over here. If there are three structures, A, B, C, is medial or B is lateral? What is correct?
Sir,
With reference to whom?
It is like if you are comparing it with A, so it is lateral. If you are comparing with C, so it is medial. Medial tab bolenge whosoever is nearer to the central line. So we'll say that B is lateral to A because A is more near. B is medial to C, right? Because C is far. So that's how all the structures, they will be defined. When it comes to invagination means when the things are going in. Evagination, when the tissue is protruding out. This would be helpful in embryology. When we'll see that, okay, for the formation of trilaminar disc, because there is ectoderm mesoderm, and endoderm, 3 layers. But it is the mesoderm which invaginates inside the layers and then it forms. Right? So for that, these terms will be utilized. So bones, muscles, blood vessels, nerves, lymphatics, deep fascia, superficial fascia, and skin. This is the order in which we'll be studying everything, right? So that's how things are: thorax, abdomen, brain. So this is the concept for today, right? Just books you talked about. So in anatomy, there's BD Chaurasia, right? That is for the anatomy theory. Cunningham Malum, that is for dissection. Inderbir Singh, it is very good book, embryology. There is another book of Inderbir Singh, which is for histology. I would say at this point of time, don't buy histology book. Abhi zarurat nahi hai. Because in histology, everything is images. I'll be giving you, I got the trinocular microscope, so which is with Carl Zeiss lens. So in that case, so here is where I'll watch. There is, say, if you are personally here, then you can watch from here. But on the third one, I put a camera. I put a Carl Zeiss lens, Sony camera, which will be giving a feed into the computer. So whatever I'll watch, you'll be able to see on the screen. So that is called as the trinocular microscope, and you'll be able to see. So every slide and all those images, they are important. I'll be giving you all the images. So no need to buy this thing. Right? Buy.
Sorry to interrupt.
बोले ना.
To upload these books on the Google Drive?
No, I won't be able to upload the books because that would be against all these books. They will be provided by your agent. They will be giving you all the books.
Okay,
I'll
sorry.
be giving you the material which we study. या फिर अपने those ये good books, right? These are the books which will be given by, and they will be giving you enormous number of books, so many. Asha, right? Gray's Anatomy is for reference. Biochemistry, Satyanarayan, right? Reference book is Harper, big book but very good. Physiology, Sambulingam and Guyton. Guyton is my favorite. Is my favorite because everything is in the form of story. So whenever we'll be taking the lectures on physiology now, samajh lena, they will be from Guyton because Guyton is like a story, right? Things start and by the end of the session you understand the entire concept. But it is difficult to appear for the exam from Guyton, right? Because kahan se shuru karo, kahan se khatam karo. That's why Sambulingam. Later on in your life, if you have read from Guyton, it will be so helpful. Because it gives you that insight. It gives you that insight. As the patient is speaking about his problems, the pictures start generating into your mind. So here is this Last Supper. This is the Last Supper. And this is the Vitruvian Man. This is about all those proportions, and he has written so many things about it. All right. So that's
Sir,
it for today. Yes.
sir, can you also tell us which edition to buy?
For medical, I would always say go for the latest edition. Because these books, they will be remaining with you for the rest of your life.
Okay, sir. Thank you.
So ideally, latest edition.
Sir, sorry to interrupt,
Nahi, bolo.
but could you show the slide for the book for biochemistry?
See, in any case, I'll be sharing this PDF with you, right? So here it is, the biochemistry. This is Satyanarayan. This is Satyanarayan. Name itself tells it's an Indian author. Harper is good, but very lengthy.
Excuse me, sir.
Huh?
Sir, you were about to tell us to do some blood tests.
Oh, blood test. No? Yes. I think you sent mail also, no?
Yes, sir.
One CBC, right? Complete blood count. So this is HB, TC, DC, ESR, right? Total count, differential count, hemoglobin estimation. This is ESR, erythrocyte sedimentation rate, 1 hour, 2 hours, all. So this is like a complete thing. CBC, when you say, all these things are included, including MCSH, etc. Right? Then you should go for LFT, liver function test. Then you should go for RFT, renal function test. Fourth is lipid profile. Lipid profile. And your D3 and B12 estimation. If you are healthy, you don't have any other problem, then that's it. These are the basic tests which are needed. For all these basic tests, right now they create those packages, because if you go for individually, it costs much. But if you take a package, so in about less than 1,000 rupees, all these tests they are done. They do complimentary that RBS, random blood sugar. If and there is anything wrong in this, then we might have to go for specific tests like CRP or HSCRP or HbA1c, right, glycosylated hemoglobin, etc. Well, only if it is needed. At this point of life, considering that you must be all well, so these many tests, they are more than enough, because they'll be giving you a reference. So at least you should go for it. D3, so that I know that structurally you are strong. B12, because it will be playing a vital role into your neuromuscular coordination and your ability to study. B12 level low, then you'll feel sleepy, feeling very tired, etc. Hard copy नहीं to soft copy. Say, Jonathan, if the soft copies, they are good, right? They are pretty good. And if you have got that digital pad, then that soft copy, in that only you mark. So it will be like a hard copy only. In some of the cases, if you want to, then you can keep some hard copies so that you can write your notes, etc. But since
Sir,
long I have stopped buying, say, hard copies, because now I use everything over here only. Yes.
sir, where will we get these PDFs?
This PDF? Okay.
Yeah.
You joined late?
Yeah, sir. Actually, yesterday only I got the message.
Acha, acha, acha. That's why. That's why. No problems. Keep this. Either take a picture of this. This is a link between you and me, right? This is link of assets. Assets means this is the place where all the books, these PDFs, right? It would be placed over there. So this is a tiny URL. So https://tinyurl.com/Dr. Bankim. Everything in small, right? Or
Okay,
you
sir.
just, this is the QR code, you just scan it and you'll get it.
Okay, sir. Thank you so much.
And one more important thing, that is, oh, it is not, I missed to write. The email address, right? It would be TILLURMBBS@gmail.com, right? This is the email address on which you can send a mail for any of the queries. More than 65 emails have been received. I'll answer all of them by the end of today or maximum by tomorrow afternoon. All right.
Okay, sir. Thank you.
All right. Most welcome.
Excuse me, sir.
Yes.
So that you are going to tell us about mental and physical fitness. So when is that lecture?
See, all those things which are extra now, you guys decide. So it's a lot. Now see what happens. More than 100 people, they have dropped off. We started with about 370, and now say we are in the range of about 250. That is something which I actually don't like. बोलते नहीं है कभी, but no, I don't like it. मतलब it is like, ये तो ऐसा हुआ, वो टीचर लेक्चर ले रहे हैं और बीच में से खड़े होके चले गए. It might be the culture in some of the universities, I never did that in my life. So anyway, yes, Jonathan, want to ask anything?
Yes, sir. Sir, regarding that message of the hard copy or soft copy, I had asked that, but I wasn't able to hear what you replied.
For the hard copy, it is for the hard copy. It is like you buy only if you really feel that yes. For say for example, BD Chaurasia, I would say yes, you can buy it because in any case you'll be utilizing it very extensively. Right? But don't buy any of the reference books. Costly, bulky. You'll find it difficult to carry to the other country. So better to keep all those things into the digital format.
Okay, sir. Thank you.
Janvi, you said that yes, if the B12 level is low, right? B12 is a water soluble vitamin, right? That's the reason you require it at a regular interval, and because it is not stored into our body in a large quantity, that's why it is regularly needed. Being a student, its level should definitely be more than 300. Right? Normal value, they say even up to 211, it is considered as normal. I would say no, it has to be at least more than 300. And in case if it is less, let me know because there are sublingual tablets. They are called as the sublingual. That means you just put it under the tongue and it will melt and it will bypass the hepatic metabolism. So it will be coming into the circulation much faster. When the cost is meager, the cost is just nothing. It is 10 days treatment would cost you about 50 rupees. महीने का 100-125 रुपए की tablets आएगी. That is more than enough. Right? But this is to be taken. Yes, and it will affect your studies very much. Yes, Om.
So your question is about writing diary.
Couldn't hear. Again.
Sir, writing diary. You
Which
told
one?
me to give a reminder.
Reminder about?
Writing diary.
Writing diary. Acha. Okay. I message you about that. Yes, Gargi. I'll come to that.
So about the anatomy books, there are 4 volumes. So I bought the first volume. So before going to the country, should we buy the 3 volumes as well? Or is one fine initially?
For BD Chaurasia, you'll be requiring all 4 volumes. And if you purchase one, go for others also.
Okay, so thank you.
Yeah.
So having all the hard copies of both 4 volumes would be better, right?
Absolutely.
Like it would be compulsory.
Because you'll be using it even in your final MBBS.
Okay, so other books soft copy is okay, but having hard copy of BD Chaurasia will be okay. Like
initially, these are some bare essential books. What I mentioned it over here, these are some bare essential. This much you will need. Right?
so having these hard copies of the books you mentioned will be preferable, right?
I was having these. Even today also, I keep this. Rest is all digital.
Okay, sir. Okay. Thank you.
Thank you. Khushmin?
Hello, sir.
Hello.
Can you just repeat whatever you said after ipsilateral and contralateral?
Say ipsilateral was on one side, right? Ipsilateral was on one side. Contralateral means on the opposite side. So these are the kidneys, right? Right kidney and the left kidney. So they are contralateral, right? They are on the opposite side of the mid line. So this is a comparative statement. And then comes the medial and lateral. Medial means whosoever is near to the midline. Near to the midline, it is called as medial, but it is a comparative thing. Right? We can't just say that A is medial. If there is no B, so we can't say A is medial. No. The A is medial with respect to B. Correct? So that out of A and B, who is near to the midline? So that is medial. So A is medial to B. That means A is more near to the midline as compared to B. So I asked a question over here. A, B, C. Out of that, this is B. So B, what would you call? Is it medial or lateral? Well, it is a relative thing. When you are comparing it with A, so B is lateral. B is away from the midline. When you are comparing these two, so B is more near to the central line. So B is medial to C. Correct?
Yes.
So that's how, and these things, because say, for example, again, talking about the brachial plexus, in which there'll be various cords. There'll be various cords, medial cord, lateral cord, posterior cord. So that is where it will come, because immediately you'll find the medial, it is relatively medial, lateral is lateral, right? Posterior is on the back side. That's why the name. And then this was the arrangement. Bones, we'll start with the bones, then we'll go to the muscles. So it is like making the entire building. First the skeleton, on that we'll put these muscles, then we'll insert blood vessels, nerves, lymphatics. So structurally everything is ready. Then we'll deep fascia, then we'll wrap it, the first coating, then superficial fascia, the second coating, and finally the skin to make it beautiful. Right? So that's how things would really go. 8 eggs per day, that's okay. If you are, I said it is not compulsory for everyone to really go for these tests. This is ideally, if you feel like that you feel a bit tired, and and as such, these tests, they will be just 1,000 rupees. कराना इसलिए चाहिए कि you know your baseline. In case if the hemoglobin level is less, especially in case if the periods are heavy or if it is for longer duration. So, and if the hemoglobin level is getting dropped, so by the end of the day or in those specific days of the month, you'll feel so tired you won't feel like doing anything. But you can't sacrifice your studies, right? So why not to make your hemoglobin better? So that will be something which you'll see it in your CBC. So these tests are not compulsory, but I would insist, if you have done this much, then most of the conditions, they can be diagnosed in case if it is. The commonest is like iron deficiency anemia. So when there is mean corpuscle hemoglobin concentration, that is less. So that means number of blood vessels are fine, but the amount of hemoglobin which will be taking part into the oxygen carbon dioxide transfer, that is less. So that can affect your efficiency. B12, so see the brain would be affected. D3, unnecessary joint pains and all those things will start occurring. And in case of females, so that is very crucial, right? And if the D3 level, it drops below 10, so then it is a dangerous situation. It can lead to what is called as the impact fracture, just heart takraya and fracture. So that becomes a painful thing. So these tests, when you do this, it is so cheap, but it will give you the insight. In case if D3 is less, so how much would it cost per week? 30 rupees. The treatment is 30 rupees. Right? Cholecalciferol 60,000 international unit. Right? It is a package of four tablets costing about 65 rupees. You have to take one on Sunday and one on Thursday. That's it. Again, depending upon the level. So when you get your reports, send it across. I'll just have a look at it and then I'll say what you should really take.
Hello, sir. Sir, I have a doubt regarding the read and scan. Sir, I'm unable to connect with the reference book you have given, the good books you have told to read. I'm unable to connect with it because, to tell the truth, I have never ever read the books except from the study stuffs.
कोई बात नहीं, no worries. Start slow. Read 2 pages every day. Right? Not much. Just 2 pages. That's enough. Gradually you
but the problem is that when I first I start with skin stepwise, then when I start the scan, when I ask the questions, I was unable to connect with the
Don't
sentence,
do
or
that.
the
Don't do
preference
that.
of mine
First,
was blank.
don't worry. Afar. Just start reading in your own style. First, be comfortable with these books. Just 2 pages a day in your own style. Right? Just first cultivate the habit of reading. Then things will become more comfortable. So no issues. Right? I'll answer
Okay, sir.
all these rest of the questions, right, by email. All right. So see you day after tomorrow.
Hello, sir.
Huh?
And so initially, which book should we buy? Like the 4 volumes of BD Chorisia or the Cunningham Garage?
No. Buy the whole set of BDC.
Okay.
Cunningham at a later stage. Abhi nahi.
So 4 volumes.
Yes.
Okay. Thank you, sir.
All right. Okay. So take care and see you soon. Day after tomorrow.
Thank you, sir.
Thank you,
Thank you,
sir.
sir. Bye, sir.
Thank you, sir.
Thank you, sir.
Bye, sir. Thank you, sir.
Sir, bye, sir.
Thank you, sir.
Have a
Thank
great
you,
day.
sir.
Thank you so much.
Thank you, sir. Thank you, sir.
Thanks.
Thank